Now, the Ghana Medical Association is warning Ashanti region COVID-19 mortalities could increase if government does not set up a dedicated facility to receive COVID-19 positive patients. Regional President of the GMA, Dr. Positve, reveals that the Komfo Teaching Hospital is now receiving COVID-19 positive patients on the wards, a situation he says is increasing the risk of infections. He also hints that more doctors at the hospital are getting infected due to lack of personal protective equipment. Dr. Beidou, in an interview with Lab FM's Erastus Asaridonko, revealed that out of 80 doctors infected with the virus nationwide, close to 20 are from the Komfo Teaching Hospital.
The situation is really bad. If you look at the statistics from the Ghana Health Service, you realize most of the deaths are from here. And if you get to our hospital, you realize if you pass through the accident and emergency unit, you realize that they are expanding the holding area. Now, you go, previously we used to have the holding area, and then those who come back confirmed are subsequently transferred to the HIU, as we call it, at the other side of the hospital. But now there is a spillover. You get it. Patients who have tested positive are being kept at the main hospital, at the emergency on the wards, and that is the situation. In addition, you realize that aside the system being under so much pressure, we have most of our colleagues getting infected. And I'm saying this because we of the Ghana Medical Association are collating the data on number of doctors who have gotten infected in the line of duty. And so we know the actual numbers. And I am saying this on authority that so many of our patients, of our colleagues, not doctors alone, but nurses and other staff are getting the infection.
Put a figure to it. How many are we talking about? Yeah,
on the last count, as I said, we're still gathering the data. On the national level, we have close to 80 doctors. We're collating the number of doctors who have it. I'm sure in the course of the week or next week, we'll get you the actual analysis of the doctors. But here, per my last count, it will be close to 15-20 of our colleagues in this hospital. And as I said, we're collating the data on them, and that's how come I know the actual numbers.
Now, you said that there is a spillover of patients. How do you mean when you say that?
You know, previously for every institution, we have holding areas, and then we have the treatment centers. When you come to Komfo, we used to have a holding area, which is a place they designated under the disaster building. I'm sure if you pass there, you see it. And then once your results comes and you are you've tested positive, you are moved to Poly. We have the highly infectious unit where they treat. You have everything set up. But then the holding areas are full, and as we're talking now, we have patients who are kept at the accident and emergency unit. These are actual patients who have confirmed, the test confirms as COVID. So you go to the accident and emergency unit. That's the situation now. And
what is the danger in that?
You know, I don't want to overemphasize this, but you realize that we know the mode of transmission, and we know because it's highly infectious. That's why we have isolation centers. But then if you are keeping those who have already tested positive in a ward containing other patients who have other conditions, one, there's the risk of transmission, because you see, all the staff entering, right? If the positive patient is confirmed, the patient is confirmed positive and they are moved there, whoever is entering that unit should be fully protected. But as we have it now, you have designated places where we are keeping them. But then everybody who enters there should be in the full PPE. But that's not what is happening. We have visiting times where you enter and you realize people are coming to visit their relatives. They enter the place, they don't have the full protective gear, doctors, nurses, pharmacists, orderlies enter the place. They are not in full protective gear. So the risk of transmission from those infected with the COVID to the staff is high. And I'm not surprised. As I said, just last week alone, I was overwhelmed because we asked all our colleagues within the region and the hospital who have the COVID to submit their names, and then when they got they tested positive, and we've submitted that. And I was so surprised to see the numbers that were coming from here. Today we were talking among ourselves, and I think something has to be done about it. Yes, the hospital is expanding one of the waiting areas. They're expanding, they think they need more space. But we think as a region, and I'm not surprised the death rate is so high in Ashanti region relative to the rest of the country. We think as a region, we should designate a proper hospital. You see, they will tell you Kumasi South is the holding area, but Kumasi South takes on more of stable patients. Those who are seriously ill are brought to Komfonochi. And I don't think, looking at the situation now, we have the facility, I mean the space to take care of all this. And that's how come patients who have tested positive are still being kept on the ward. If a hospital like Kumasi South or any of the hospitals within the metropolis is closed down, all the patients they transfer to other hospitals so that the hospital will be dedicated solely to the treatment of COVID, as has been done for Gas South. That is what will save the situation, because if we don't take care, the spillover here will continue. More and more patients are coming, and you see now almost everybody who comes in with a suspicion of COVID, we test, they turn out positive, because I think contact tracing is no longer happening. People are falling sick, so the first time they come to the hospital, they have all the classical signs and symptoms of COVID. We test them and they are positive, and there's nowhere to take them. So eventually they will keep taking one ward or one space. After, when that place is full, we move to the next ward, we move to the next ward. So with time, the whole place becomes full of them. But then as this is happening, those who have accidents are coming. Those who have diabetes and complications of diabetes are coming. Those who have hypertension and hypertensive crisis are coming. So we will end up losing patients who are not COVID positive because their spaces has been taken over by the COVID cases. And because you can't put all of them together, you realize that we may have to struggle to deal with it. And that's the danger.
Now, early this week, we intercepted a memo which was indicating that because some doctors have been exposed, they've been asked to self-quarantine, and so the ICU will be running at half-mast, if I should put it that way. What's that situation? Tell us about it.
Yes, what happens is if somebody test positive in the unit, you have to decontaminate all the place. And as you rightly said, I think I also saw the memo, I think this morning or so. And after I read it on my Joy online, I went to check. Yes, from the memo and then from what I read is the entire staff there who came into contact with the patient who tested positive. We don't know whether the person got it in the hospital or had it, brought it within the hospital. So it means they all have to self-isolate. And in the intensive care unit is a highly specialized unit. I cannot work in the intensive care unit because I don't have the expertise. So if all of them are exposed and are waiting the results after, they will be tested and are waiting their results and then the subsequent testing, of course, it makes sense to shut down the place. But what it means is patients who really need intensive care unit, it's not only COVID patients who will be sent there. We have patients who get accidents. They come, their consciousness level is so low, and they will need ventilators to support their life. It means we can't do that because the staff to take care of them are not there. They are all quarantined. It doesn't end there. As this is going on, with time, this is the intensive care unit. It can come to the other unit. So if you have every week your staff being exposed, and then going on quarantine, What happens is, with time, somebody comes to the hospital and we don't have the required number of people. And see, I mentioned this weeks ago, and we seem not to be paying attention to it. But that is what is happening. So we may be losing COVID patients. We may be losing patients who come with non-COVID related conditions, because you don't have the requisite number of staff or the expertise. Yes, you may even have the staff, but if you don't have those with the expertise to deal with the condition, we are going to lose them because the people are in quarantine.
Okay, what is happening there? Because I see holding areas for COVID-19 patients, and I see people go in with full PPE. Now we are having patients on the ward where I walked through today, and they're just mingling with other patients. Would you say that we are not taking things seriously in Ashanti region?
Oh, you mean you went to the ward and you saw that?
I went to the accident and emergency area, through to the chief executive's office, and I came back.
Okay.
And so, would you say we are not paying attention to protocols?
Erastus, I'm glad you said you saw it for yourself, but that should tell you the danger we are in. Because if you don't take care, what is happening in that facility, a time is coming, everybody there will have to self-quarantine because once you walk in, as you are describing that the situation is and you saw it for yourself, meaning aside we, the staff working there, getting exposed, quarantine, and some of us, of course, will test positive and some have tested positive, those visiting, you get it, those visiting will carry the condition from the hospital. That's if they don't have it already from the community. They come to visit their relatives. Because you see, in this hospital, most of the services, you need something, relatives will have to be called to go get it for you, and that's what is happening. So they come to the hospital from wherever they are. Well, they may go in because their relatives are kept in a cubicle. The COVID patients are kept in another cubicle next to them. They enter, they are not protected. So they carry it from the hospital to their homes, and we are going to compound the situation in the communities. And we look at it is like people will think you just, instead of keeping calm or preaching calm, you are preaching, you are panic. But this is the reality. You see, a couple of weeks ago, I think I spoke with your network and I said, if we don't take care, we move the fight from the community to the various hospitals, your hospitals get overwhelmed, and that's when the mortality starts going up. Because you come, the system is so overwhelmed that nobody actually pays attention. And if even they will pay attention, the people to do it are not there. We have various units that has been closed down because patients who were on admission tested positive, so those non-positive ones will have to be moved to other wards. Meanwhile, they've been with these people over time. So the situation is serious.
What should be done? What is GMA recommending that we should be done?
You see, for us in the Ghana Medical Association, we always we work in the interest of doctors, healthcare personnel, and in particular the general populace. So when the public hears of Ghana Medical Association, they shouldn't see us as enemies but advocates, because we are there to seek their interest. We think the general public should put pressure on their minister, on the government to, as a matter of fact, first thing, provide PPEs. Because you come to the hospital, the first thing is that we are under so much stress that things like gloves, just disposable gloves, are rationed. Things like masks, you have to fight at times to get it. Some health personnel are providing their own PPEs to take care of patients who are Ghanaians and even non-Ghanaians. If even they are non-Ghanaians, they are human beings. This shouldn't be the situation. we have more people coming in here, but we have less of the PPEs. They will tell you they are making effort they've sent so much PPEs, but that's not the situation on the ground. We buy our own mask, we buy our own shield. At times we go to work with our own gloves, because as the president said, the fight depends on you, your survival depends on you. But this shouldn't be the situation, because it's demoralizing. So we're calling on everybody to put pressure on the powers that be to make sure they get the facilities what we need. People were donating to the COVID fund. Let me ask, you can find out you said you've been to the CEO, or you can go back to them. How much of that money was brought to Konfanochi? I saw cards that were branded COVID, blah, 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 blah. I don't know. Konfanochi hasn't got one. When they said the cars were to transport the sample to the testing site, and we don't. PPEs, we hear of it all the time. You come here, we don't see them. House officers who are genius, medical officers who are genius, residents who are in training are forced to work. It's not only in Konfanochi, most of the regions without the requisite PPEs. And you shouldn't be surprised more nurses and doctors are getting. That's the issue. So we should insist and we encourage the general public to put pressure on the powers that be to augment the supplies for the various hospitals. And then secondly, we are appealing to the Ghana Health Service and the Minister of Health to, as a matter of fact, consider one of the hospitals within the metropolis, just as they did for Kumasi South, as COVID hospital, shut it down, evacuate all the patients there, transport them to other hospitals so that we dedicate that center as COVID center. And I believe once we do that, that's going to help minimize the death rates. It's no wonder we have the highest death rates relative to the rest of the regions.
The situation here is dire at the moment, and the Accident and Emergency Center, which you see behind me, is the source of referral for many hospitals across the region and even beyond. So we have emergency cases coming here all the time. Now, the situation here is such that many of the doctors and nurses have been exposed to COVID-19 in the last 4 days. And so many of them have been asked to self-quarantine, and a test have been conducted. We understand that the results of the test will be in 24 hours. And so before that time, they are making do with the few doctors they have on duty at the moment. When you enter, you will see that the once busy triage area or the intensive care unit area is a bit empty today, except for few emergency cases that need urgent attention that the doctors have started looking at it. And even that, there are not so many doctors available, so many of the patients will have to wait for a while before they get attended to. If you can see just behind me, the ambulance is parked there. They've brought in a patient and they are going through the triage process. When I entered, after that they will have to wait for a while before a doctor could attend to that particular patient. And so per the memo we cited, which indicated that all ICU emergencies will run at half-mast, meaning that there are not so many doctors to attend to patients, and so only emergency cases, urgent cases that need attention will be attended to, and that is what is happening. We have tried to speak with management of the Konfanochi Teaching Hospital, but we were just told that they are locked up in a meeting, and so they cannot see us at the moment. And so since morning we've been trying to speak with hospital authorities, but they have declined our request. It's a hearing that it's possible that those on leave, that is health professionals on leave, might be called back to duty to fill the void at the moment.
But a very simple thing you can do to help the situation is stay at home if you don't need to go out. Cover your nose and cover your mouth, and of course use the hand sanitizer, wash your hands.